Welcome to the Thoracic Surgery Unit at Qasr Al-Aini Hospital. Here, we evaluate and treat countless patients dealing with chest wall abnormalities. Out of all the questions patients and families ask when they sit down in my office, one comes up more than any other. Can this be fixed without surgery? To answer that, we look at what Pectus excavatum actually is. It is a congenital deformity where the sternum caves inward toward the spine. The inward curvature of the bone physically traps the internal organs, leading to what we call cardiopulmonary compromise. Because the effects range widely from a purely cosmetic issue to a condition that causes severe shortness of breath and exercise intolerance, searching for a single, universal treatment is a flawed approach. It is entirely natural for patients and parents to want to avoid an operation. Surgery involves acute physical stress, a hospital stay, and recovery time. On the left of this spectrum, we see a mild depression. The chest wall is indented, but organ function remains completely normal. Moving towards the severe end, the anatomy changes. Here, the inward-facing sternum actively squeezes the heart and compresses the right ventricle. This physical reality dictates our approach. The goal is never to simply pick a preferred device or procedure off a menu. We have to match the intervention exactly to the patient's specific anatomical presentation. Choosing a treatment path based solely on the fear of surgery while ignoring what is happening inside the chest guarantees wasted time and allows the deformity to progress. The most widely studied non-operative treatment available today is vacuum bell therapy. It is often pitched online as an easy alternative, but we need to look at how it actually operates. The device works by applying negative pressure to the chest wall. As you can see, this suction physically pulls the sternum upward and outward. When you remove the device, the sternum eventually settles back. The only way to force long-term skeletal remodeling is through thousands of repeated sessions over months and years. This chart illustrates the true cost of conservative treatment. Along the bottom axis, you see the massive time investment required, wearing the device hours a day, adhering to the routine for 12 to 36 months. That massive time investment only translates to high correction impact for a specific subset of patients. As we plot out age groups, only the youngest patients land in the successful zone. Vacuum bell therapy does help you avoid an operation, but it trades the acute stress of a surgical recovery for a strict, grueling daily physical discipline that lasts for years. To figure out if a patient has the stamina and the biology to succeed with conservative care, thoracic surgeons use a specific diagnostic pathway. This decision tree starts at the top with an objective evaluation of the chest wall. The first filter we apply is age, which directly correlates to flexibility. Notice the split between patients under 12 and mature adults. Pre-adolescents and early adolescents possess highly malleable rib cartilage. Their skeletal structure readily yields and adapts to the sustained negative pressure of a vacuum bell. Once a patient reaches adulthood, that cartilage ossifies. It becomes rigid bone and dense connective tissue that resists remodeling. Consequently, success rates for adults are significantly lower. Attempting to reshape a mature, rigid chest wall with suction is fighting an unwinnable battle against basic human biomechanics. Even if a patient is young and flexible, they must pass a second major clinical filter: the depth and symmetry of the physical depression. Going back to our decision tree, the pathway divides again. We separate mild, symmetrical deformities from severe cases. For patients with severe cardiac compression, the path ends at mandatory surgical intervention. Highly asymmetrical or severe deformities do not remodel evenly under vacuum therapy. The suction cannot selectively target the deepest points, leaving the internal organs restricted. In these situations, we rely on the Nuss procedure. A curved metal bar is inserted behind the sternum and rotated, forcefully elevating the chest wall. The trade-offs are significant. This approach delivers immediate, permanent elevation, but you must undergo hospital recovery and live with internal hardware for several years. For individuals suffering from severe cardiopulmonary symptoms, surgery is not an optional choice. It is the strictly required functional solution to protect the heart and lungs. Let's step back and look at the biological requirements for both of these treatment paths side by side. The left column shows the ideal candidate for vacuum bell therapy: young, typically under 12, with a highly flexible chest wall and a mild symmetric deformity. The right column dictates surgery: adult patients with rigid chests, asymmetric depressions, or clear cardiopulmonary symptoms. The timelines are entirely different. One path requires years of gradual, uncertain remodeling, driven by your own daily discipline. The other offers an immediate, mechanically guaranteed correction. The risks scale accordingly. Vacuum therapy might cause superficial bruising or skin irritation, with the biggest risk being a failure to comply with the schedule. Surgery carries the risks associated with anesthesia and internal hardware. The critical takeaway is that you do not get to pick your preferred column. Your inherent anatomy strictly dictates which scorecard applies to you. This is exactly why attempting to self-diagnose the severity of your condition or ordering a vacuum device online without clinical imaging is dangerous. This infographic highlights strict medical contraindications for vacuum therapy. Patients with underlying musculoskeletal disorders, vascular issues, or coagulation defects can suffer harm from negative pressure. Ignoring these warning signs or gambling with your cardiovascular health simply to avoid a doctor's visit can turn a structural issue into a medical crisis. A successful outcome begins with an accurate diagnosis of your internal mapping. Before you commit to any routine or procedure, book a complete evaluation with a specialist thoracic surgeon. Let the actual shape and flexibility of your anatomy guide your choice.